Mo bhuicas tá sin féin a rís as an deis canse seo agus chur síos Seirbhísí leis tíomh muite in a hospital agus cóluchtach is atá sé in anón policy an rialtas le fad an law. I thank Sinn Féin for the opportunity to speak on this. I thought I wasn't going to make it, but I am. And it's a very practical motion, calling for action, calling for a task force to be set up and develop a public contract for GPs. Of course, this has been done in our neighbour a long time ago, and other practical suggestions, and I couldn't disagree with it. And last Monday week, I was in a public meeting organised indeed by Fine Gael Senator Sean Kine out in Clifton, and there was over 200 people in a small hall because the district hospital is closed once again. So there was somewhere between 200 and 250 people there expressing their utter frustration a year later approximately from a previous public meeting where they were given assurances that it would be kept open. And I say this in the context of Galway City. Today, on the 20th of March, there are 33 people on trolleys in Galway Minister. You know, I'm going to zone in on 33 people on trolleys. I ask any of you gentlemen, did you ever spend time on trolleys? You have. Not pleasant. Not pleasant. Indeed, somebody working with me, somebody related to them were in trolleys, utterly chaotic in a hospital in Dublin today. And I'm here since 2016 and nothing has changed. So if we look at Hiqua visiting the regional hospital last year, which serves almost 1 million people, Minister, Hiqua said in March of last year that the department, the emergency department, was grossly overcrowded. I think it had something like 27. Today we have 33. On the 6th of March we had 52. So an ongoing problem, ongoing pressure. Now, I think all of you nodded that you were on trolleys, but I really would like to know how long you spent on trolleys, because it wouldn't be unusual in Galway to spend anything between 24 hours and 6 days on trolleys, depending on the season, depending on phone calls to TDs. And a desperate situation for the patient and for the TDs to be contacting a hospital to say how many people are on trolleys. And so that clearly tells us that the hospitals are under-resourced, understaffed, and on occasions badly managed. And so therefore that's why we need primary care centres. And back in 21 we rolled out a strategy, and unfortunately that strategy has never properly been fulfilled and indeed hasn't been reviewed. And so we see company after company setting up. Indeed, the former chairperson or the CEO, I can't remember what the title was of the CEO, is now one of those companies working with another big company, owning the private care centres that this government and the health executive is dependent upon. And so we have health centres being built either in a public-private partnership or completely private and leased back then to the state at enormous rents. And those rents don't even satisfy the owners, because we see from recent reports in The Independent that the primary care centres have been stalled because they don't believe they're getting enough rent. So we've absolutely learned nothing from the financial crisis, and we've learned nothing from the privatisation of medicine over and over again. So the primary care strategy, Minister, you know, in your reply, again, I asked the Taoiseach earlier on, please, if you could depart from your script and actually deal with the issues we're raising. We're not doing it to embarrass you. We're doing it because the system is a complete mess. And you're now relying on private for-profit companies to build the infrastructure for primary care. In Galway, just outside Merlin Park Hospital, we have a primary care centre. I understand that the rent is $250,000 per year, every single year. Nothing to be gained by the state, only helping companies to make profits, completely in the arms of private companies who can determine the conditions. Now, surely at some stage we should be reviewing the risk assessment and the cost effectiveness of such a model, but we're not doing anything like that. In the heart of Connemara, I gríleor na Gaeltachta, níl plan bith le haid ionad cúram príomhúil don cheantar. Sa Charrúa, níl plan bith chun ionad príomhúil Sláinte a chur fáil an sin. Tá si de cant faoi ionad sa spideal, agus cad tá tarlaí? Támuidig fannacht an ferberthóir príomháideach chun sin a chaláthar dún. Agus muna nairion leis nó léhí ní bhaid in ionad cuaram príomhú legan. So in the heart of Connemara, there isn't a single plan for a primary care centre. The nearest plan is in Spiddal, which is in Cosharige, and will not serve the vast area of Connemara. And again, that is in the hands of a private developer. I have no problems with private developers, but when we're utterly reliant on them, and if they decide they're not building it, or if for other reasons, for instance, if they're in trouble or if there's planning problems, then there's no primary care centre. That's the situation as I speak. We finally got one in Míochaine after many years, again on a private basis. And if we go back to the Áras Victara in Carrow, the day centre functions 1 day a week. Can you imagine the management tell us there's no demand for a day centre in Greeley or Connemara? And then the Clifton Hospital is closed, a wonderful hospital in theory with wonderful staff. And we were told by that wise management a year ago there was no demand for a district hospital. Then we were told there was a problem with staff. And then we were told there was a problem, a union problem. And finally we were told that the new nursing home, 40 beds, it was to have 50, reduced to 40, will solve all the problems. There's some misunderstanding here that a district hospital is the same as a nursing home, and then the nursing home will fulfil the role that the district hospital had. We had a GP stand up at public meeting, actually just appealing for the second time to do something about keeping the district hospital open. So the focus of the motion tonight is on primary care, on improving conditions for GPs. We can do none of that unless we roll out the vision. The vision was set over 23 years ago and it was never rolled out. Indeed, it was one of the reasons, as I understand it, that Deputy Roisin Chartall left the Labour Party, because of the manner in which that party in government was dealing with the primary care strategy. And here we are in 2024. And Minister, I would love if you would tell me now when you stand up how many primary care centres that we are in the ownership of the state. How many ones are in planning but are held up for various reasons, financial or planning? And I would like you to tell me, when are we going to have a review of the primary care strategy? When are we going to have a review of the day centres, an essential piece of infrastructure to take the pressure off the hospitals? The HECRA report, when they visited the hospital last year and they said it was grossly overcrowded, remember I told you 25 or 27 patients, that has been trebled on occasions since then. So the word grossly overcrowded loses its meaning. If it was grossly overcrowded in the mid-20s, what language will we use when it's in its 60s, as has been repeatedly? And how do we keep going from crisis to crisis rather than building up the basic infrastructure that every single town needs? And so we go back to Carrow. Where is the day centre? We go to Inishbofin. I have a library of replies in relation to the transfer of land to enable a primary care centre be built on Inishbofin since I came in 2016, and we still haven't got a primary care centre on Inishbofin. Same as Arden off the coast of Galway. They were promised a brand new primary care centre. Now at some stage, if I'm here 8 years and I have never seen a review, I've never seen a minister stand up and say this is unacceptable. We need to review this. We need to take the pressure off the hospitals, and we need to give basic services to the rural areas and to the towns. I'll work with you. I'd be delighted to hear some senior or junior minister actually stand up and say that. Instead, we go from crisis to crisis, and we're reliant on the Independent to tell us the problems in relation to the provision of primary care centres. We see people who are heading the health executive walk into other jobs in the private sector and benefit from their knowledge of what's needed, rather than having learnt a lesson from COVID and from the financial crisis that certain services are absolutely essential to a civilised society. And primary care centres are one of those. And it makes sense on so many levels. And yet, here I am, 8 years later, highlighting the absences on the ground, reliant on a Sinn Féin motion to put pressure on a government with the rest of us in opposition, while the government utterly fails to be honest, direct, and tell us what the problem is and learn from their mistakes.